so much for joining us. So as an industry, we hear so much of the challenges that you all face day in, day out. And I think some of those are specific to pharmacy, others are generic businesses challenges that we all face, businesses across the UK. We also hear of the number of opportunities that are on the horizon. And right now for pharmacy, it's got a prime opportunity to shine in particular as that front door to health. But rarely do we always see, share and celebrate the true successes and how pharmacies are navigating that landscape and achieving success. So how are they bringing those jigsaw pieces together? So today, what I'm going to do is I'm going to share with you the successes of real people that are in our industry, sharing their best practice and ultimately how are they being the early adopters and proving the art of the possible. So the journey starts here with people and time. So this is exactly what RD Hill Chemist faced. Now, Stephen, as you can see on screen, he's the manager here of this independent community pharmacy. Now, they're based in Barnsley, Yorkshire, if you know of the area, and they process over 23,000 items a month, and they have over 6,000 patients nominate them as their chosen pharmacy. So a bit of context for you there, if you can relate to that. Now, the challenges that Stephen faced was the increase in volumes, they've got increasing costs, but they've also got decrease in revenue. So when we look at the CPCF and the makeup of that contract, they're in a really difficult pinch point. But Stephen could also see that his team were doing these mundane, repeatable tasks that weren't really maximising the potential of his team. So he knew the answer here wasn't just about adding more people to that. So we've just talked around that cost challenge. So more people might give a bit of capacity release, but it's not going to help with his costs. So we went on a journey with Stephen to understand how could we unlock his potential and solve that challenge. So Stephen took an evolutionary approach to his dispensing journey and he mapped out that process because what he knew was that if he just revolutionized his process overnight, it was just going to disrupt his business and disrupt his team and the flow that they were in. So he broke up that dispensing journey into those key component parts that we'll all know well of. So the sorting, the picking, labeling, checking, claiming, etc. And mapping that out, he could see there was huge potential for efficiencies here and that there was technology solutions on the market that could really help. But he needed a system that was going to adapt to his way of working. He knew his team best, he knew his business, he knew how he wanted to maximize those efficiencies. So what was key was that he could use a system that modularized that dispensing approach so he could piece together his dispensing journey in the way that he wanted, rather than pick a system that simply forced him down a path and a certain workflow. So taking that methodical approach, he made sure those changes were implemented step by step. So we first tackled that sorting in terms of prescription type and getting the right people doing the right jobs in his store. And it was all around incremental changes and those 1% efficiency gains every day that businesses need to achieve. Now, to enable success, it was also key that the system that he chose was intuitive. It was easy to adopt those changes, but also that it was equipped with any learning content that certain members of his team might have needed to just validate their thought processes and understand how the system worked. But he also needed a system that provided visibility and give the team trust and confidence in what the system was doing. So it needed to show how much efficiencies they were making and also give them trust and confidence because as a team, it was automating processes that they never thought were possible to automate before. And change can be a scary journey. So it was important that the system did that. Now, it was important that he used technology here to drive those efficiencies because we've just spoken around how people and the cost challenge that pharmacy faced. So technology had to drive the efficiencies here. Now, we've not yet calculated the true profit margin increase that Stephen's seen by automating and using this technology solution, but no doubt with the pressures that it's alleviated, the benefits are going to be huge here. So by choosing this route with Pharmacy Manager, which is the platform that Stephen used, he says, Stephen at the store here says that the efficiencies have now released his team so they can focus on the high value activity. Not only that, but the team have seen some incredible results across their patient retention stats, and also his patient nominations have grown by 10% since implementing these changes. So let me just walk you through how the system has enabled these results. So the new workflows and innovation that you can see here has shown massive time savings to dispense. And this is the journey that he went in, starting with version 15 and then the other versions of the software release that he's taken. And in total, from that end-to-end journey, he's saved 42% of his time. So that equates to 4.2 hours a day if you're a pharmacy dispensing, on average, 150 prescriptions. So give you a bit of context for your world and how that might multiply. And this all starts with an intuitive homepage that gives that helicopter view of the dispensing world and allows for that effective sorting of prescriptions and doing that digitally. So no printing, having to sort them by piles. The technology does that work for them. Also, it then flows into a business intelligence engine, and this is where all the magic happens. So this is allowing repeat prescriptions and labels to be printed with just simple one clicks, but also it is then looking at doing the clinical check process. So it's checking using clever algorithms that are working behind the scenes to know what does Stephen actually need to check as a pharmacist in that store and what can simply flow through straight to his team to dispense. So it is those algorithms that are doing the legwork for his team. But it's also key to see whose time is it unlocking. So which role is it within that store? And in this journey, it's the pharmacist's time that's being released, which is critical because it's the pharmacist that can unlock a lot of that other high-value activity here. But for us, this isn't just around saving time and quoting a 4.2 hours a day saving. It's about allowing you to unlock your potential and your success in the community. Now, the next journey of success that I wanted to share with you is that of Michael's Chemists. Now, Michael's Chemists, I've been really keen. And when we're looking at this, it's all about the S word, which is services, which we know is massively hot on the agenda right now. The services agenda isn't new to pharmacy. You'll all know it well, but it is growing at an incredible pace. We know the Pharmacy First scheme is also hot on the horizon too. So what it was important in Michael's Chemist case is that they could not just release capacity, but actually how can they deliver services in the most efficient way? So we don't want to have all of that complex world in dispensing we talked around replicated in services. We need to plug those efficiencies and the technology efficiencies into the services agenda so they can deliver them. So to talk around this, we're going to talk around the new medicine service, which I'm sure you'll all be familiar with. It's a service that many of you will know. So our shining star, as I mentioned here, is Michael's Chemists. They're an independent pharmacy. They're a group of two, just on the outskirts of Birmingham. And they have around, on average, 4,000 patients that nominate them at either branch, and they process over 9,000 prescription items. Now, they're regularly charting within the top 20% of the country in the NMS league tables. Now, the owner here, Karanjit, took the team on a journey of change here. So they were using the PSNC or CPE form for completing the NMS service, and they had paper everywhere. So every service NMS interaction was completed on a paper form. They had that in a folder. Along that folder, they also had post-it notes, which were color coordinated by the month of when they needed to next contact that patient to follow through with that NMS journey, which just seems like it was just ludicrous. It was bonkers. They were losing track of the services, so they actually couldn't complete a lot of the NMSs they started. So they were just wasted time and resource. And actually, Karanjit couldn't see the workload and volume either. He could see a massive folder bursting with paper, but it didn't give him any data or insight. And people say, achieve for a target, but that was just a dream for Karanjit at that time. So what Karanjit was looking for was a system that streamlined that process. Because he also, when they were setting up an NMS patient, he recorded that it was taking them on average 10 minutes to actually establish a patient for that NMS service, which is a huge amount of time to do so. So he needed something that digitized that process, removed that burden, but he also wanted something that was mobile, something that he could use on any device, whether that be a tablet, iPhone, whatever that is, so he could be released from those shackles behind the desk and actually go and engage with the patients to complete the service. He also thought, can I not use something that's going to take those patient details I already have in my PMR and auto-populate rather than re-ask them questions that, how much of a personalized service is that? Can I just take your name, please, or your date of birth? You should know me if I'm a patient connected to your pharmacy. So he implemented a digital solution here that completely transformed that process. It digitized the process. He also got prompts that reminded him when there was a service opportunity, so he never missed one. It removed the double entry, but it also managed the process from end to end, so it completely streamlined that journey all the way through to the claiming part as well, so he never missed an interaction. More importantly, though, it also allowed him to set a target, but then measure his team's performance in real time. So he could see how many each of his team was doing, how many NMS services were they completing, were they on track, and it reduced the setup time for an NMS service from 10 minutes to less than a minute. So a massive time saving there for them. And the results speak for themselves. So he's tripled his NMS revenue when we compare Q1 last year to Q1 this year. But also his patient nominations are up 12.5% as well. So he's getting more patients as a result of being able to provide that better service. And he had the data and insights to drive his team forward. So Karanjit used the pharmacy services platform, and this is digitally and seamlessly integrated into his pharmacy PMR, and it completely transformed the processes for them. This is the same platform that RD Hill used that I spoke around before, and RD Hill are actually in the top 1% of the country when it comes to performing the NMS service here. But how on earth do I scale that? So you might have an independent pharmacy, but what if I have more than one pharmacy, 10 or 20? So to talk around a pharmacy chain that did just that, we're going to talk around Weldrix. So Weldrix are a 60+ site pharmacy chain. So they are based in the heart of Doncaster, and they pride themselves on giving an amazing customer experience. So 5-star is what they're aiming for, and they're rated as highly as that on Trustpilot. Across the group, they process over 500,000 prescription items per month. So they're a busy chain as well. Now, Richard Hackett, who you can see on screen there, he's the head of pharmacy here. And what he needed a solution for was for the hypertension case finding service. So this was his problem. He wanted to introduce it to Weldrix, but didn't quite know how. What he also knew is that it's quite a cumbersome service in terms of the process that you have to follow, but with also all of the updates that you have to do to the GP practice, it can become quite paperwork heavy quite quickly. And he knew that capacity was really tight in his stores already, so he couldn't introduce a service or then poor technology that was just going to burden his teams and potentially send them into overload. All these services are great and we want to do them, but we only got so much capacity to do it with. So Richard had a look at all of the services platforms that are available on the market. So he went out to do a market scan of what was there to complete this service. And he wanted something that was easy to use, it was intuitive, it gave them the clinical guidance of the service when and how they needed it, it removed the burden and pain of remembering to claim, but it also didn't provide a massive management overhead to roll out the service, because rolling out technology can be a difficult challenge to a group of that size. And he also didn't want something that would take forever to train his team on, because that's also, we don't have the time to train them, so I need something they can just pick up and use and run with it. So Richard chose a digital platform. It was web-based, so it just needed logins for all of his stores. He gave them a quick team briefing, set them all up, and off they went. Within 1 month, all but 5 of the stores had completed a service on the hypertension scheme. And in the month of August alone, the group conducted 898 hypertension case finding services across their group. You can do the maths on the numbers with that for the service revenue, but a significant result that they saw. What we've also seen is that they're now trending above the national average in terms of how many services they're doing, and they're above the national average by 20% across their group. So some fantastic results. Again, Richard chose that pharmacy services platform. It was seamlessly and digitally integrated into Pharmacy Manager for them, and it brought about those much needed efficiencies. And for him, it took away the thought of the staff not even claiming at store, because it is seamlessly integrated into the NYS platform that you'll know about. So as soon as they complete that service, it pushed and the claim was submitted. Now, I wanted to showcase the work of Weldrix in particular because of the fantastic results that they saw, but also because we all know we need a solution that can handle multiple services now of varying degrees of complexity as well. But the services agenda is about to grow even more so. If you was here this morning for the first talk, you'll have heard around the primary care recovery plan and what that means for pharmacy. So he knew that he needed something that would work for that. The pharmacy services platform that Richard chose is going to be one of the suppliers that's first to market ready for that primary care recovery plan. So they've already got a solution that's ready and waiting now that they can use for when that pharmacy first scheme comes across. And that 645 million investment that Rishi's committed to the industry, they'll be able to unlock that as soon as that materializes. Now, the last success story that I really wanted to share with you is navigating that service delivery at scale. And this is something which the Avicenna Group have got just right. Now, Sean is the operations director for the Avicenna Group, and they are a 135 strong group. Many of you will probably know them. They've been growing at a significant pace, and they've seen some really good results. Now, if you look at what their business model is about, they pride themselves on 4 key things here. They're fanatical about local. It's about being customer first, technology empowered, but also green. That is what they pride themselves on as a group. Now, what Sean knew is no matter how simple a technology platform is, how widely he communicates a target to his team, how much he tries to get that team to embed those processes, trying to change your store's cultures and behaviors and get them working the way you want will take time. But Sean really didn't have time to enable some good results. Now, not all services require a physical interaction as well to complete them. So this wasn't just around dispensing efficiencies and how the store was operating. This was about the mobility of technology and ultimately how he could get the right data, insights, but also foresight to allow him to unlock this potential he could see within his group, but he couldn't yet materialize. Knowing that additional services are on the horizon too, Sean needed something that could unlock that capacity for him. But this also was in relation to the NMS, which we've seen the significant benefits that the Avicenna Group have seen. And if you know the NMS service, this isn't just around hitting a number in a service target. There's quite a complex payment matrix behind it. So you'll be paid between £20 to £28 per service, depending on the percentage of services that you do, which is all dependent on the number of pharmacy prescription items that you're claiming for in that month. But I only know how many prescriptions items I've done at the end of the month, so how on earth do I set a target that works back from that? So it's quite a complex matrix. So the challenge was that he needed access to his own prescription data, but he needed to know what other pharmacies were doing, some of the BSA data, and then something that could take into account the seasonality and the trends so he could understand what his prescription item volumes were looking like. So he needed a solution that had that intelligence at its heart and took the guesswork and manual effort out of setting his service delivery targets for the group. So by looking at his data, the NHS data, understanding that seasonality and trends, that solution needed to be powered by machine learning algorithms. And by using that, he got to within a 90% accuracy of the target that he needed to set. So he could simply plug into the system, I would like to do my 40% of my NMS target. And the system would say, okay, store X needs to do this number of NMS to be able to achieve that target. So it managed that for him and communicated that to his teams. But he then needed a platform that could show him in real time which stores were doing what level of services and what percentage of their target were they achieving, what stores were hitting the numbers, what stores weren't, and then how could he provide that centrally and then enable central resources to go in and assist those teams. So using the data then, he was able to drive the decisions of his management team to be able to maximize the potential, and then a services platform that enabled him to complete the NMS service remotely. So that meant that he needed the right patient information and details to complete that service in a central place. We need to get that information out of the store so they could do that. But then he needed that platform, as I mentioned, to show where were those stores performing. So he could then mobilize his resource and his troops centrally to go in and help pick that store. So if they're suffering from sickness at the minute, rather than just miss out and realize that at the end of the month, let's send the rescue mission team in to get that NMS activity up and through the door. But then this became really interesting because it wasn't just around hitting a target. But as the service mission completely flows and demand ebbs and flows as we go through seasons, and flu season had just come live. So then Sean's challenge was, I need to maximize my flu service potential because I've got a limited market to do it, but I don't want to stop the team doing NMS to do flu, and then I'm just replacing one revenue stream with another, so I'm not gaining anything. I needed to be able to do both. Can you help us do that? But with that remote enablement through this pharmacy services platform, Sean could do exactly that. Now, the results have been phenomenal with what we've seen. So Avicenna have conducted 47% of their NMSs remotely. That work is removed from the stores. They've also seen an increase of 294% on the number of services when it comes to NMS that they're delivering in a month. And that was since just January this year. So they've seen that rapid growth and uptake. They're astonishing results. And, we talk around revenue and hitting numbers and targets, which is all well and good. But what it's really done, it's enabled Avicenna to meet the needs of their community. Because their community are now rightly getting vaccinated for flu, whilst also rightly getting the right advice for taking new medicines, which is critical. This was all completed using the Pharmacy Intelligence Hub. So this was the tool that was doing all of that clever stuff around machine learning, the algorithms, taking the pain away of hitting that service targets, whilst also utilizing the pharmacy services platform that enabled a really streamlined process for processing that NMS service. You heard about the time savings with Michael's Chemist. Well, it just made it really easy for Avicenna to achieve those results. So that's an amazing success story. So back in 2019 for us, this is when that journey started for us as Cegedim. And we could see a lot of these challenges that were on the horizon. And our aspiration was to become the trusted partner for pharmacy business solutions. So when you want a solution for your pharmacy, who can I trust and who's got my needs at their heart that's going to meet them? That was our aspiration. We had 3 key goals that we wanted to achieve for you. That was to save you time, make you more money, and delight your patients. They are our aims for you. Now, with the cases of RD Hill, with Michael's Chemists, Weldrix, and Avicenna, you can see how that vision is really becoming a reality. But we haven't done this alone. This hasn't just been us. This has been as a result of working with customers like these. And we call this discovery. This is product discovery at its heart. It's not just about coming to you as a pharmacist and saying, what do you want? There's a technology to do. This is around us walking in your shoes, actually immersing ourselves in your world, understanding where your pain really is, because where you first might see it might not actually be the cause of that pain. And when we truly understand where your pain points are, it's only then when can we really design amazing solutions that work for you. Now, we know that each pharmacy has varying strategies, varying paths of success that they want to achieve. So I would really ask you, if you really want to know how we can unlock your success and your potential, our stand is located just over there. You can come and speak to me and the team, and we can fill in your check. So we've been doing some data. We have your data. So any pharmacy in England right now, you can come over to the stand. We can show you where your potential is. We can show you where you're performing. But ultimately, if you then embed these solutions, what performance level can we get you to? So thank you so much for listening to me today. So I've been Adam Dennett. I'm the Managing Director of Cegedim Healthcare Solutions. But I'll be more than happy to take any questions that you may have.